On behalf of the Aging Project's Board of Directors, welcome to Aging Project's Aging in Place, It's in Your Future Virtual Fall National Conference 2020. 6 engaging topics, information you can really use and you can refer to time and time again. Watch at your leisure with family and friends, take notes, and learn how to plan for your future. Help for you and peace of mind.
Hi, I'm Keith Logan, Executive Director at the Council on Aging for Henderson County.
And I'm Heather Bauer, Executive Director for Council on Aging of Buncombe County.
We're here together today to share a little bit with you about what our respective organizations do to serve the older adult population in Western North Carolina. So Heather, why don't you share a little bit about who you are and your mission and your services that you provide?
Thank you. So Council on Aging of Buncombe County has served Buncombe County residents for over 50 years. Our mission is to promote the independence, dignity, and well-being of adults through service, education, and advocacy. Our staff and volunteers every day are committed to living that mission and ensuring that the lives of those living in Buncombe County are not only reached through our service, but promoted and advocated for to ensure that they receive the best care possible with options for aging in place and during important transitions in care.
So what kind of services do you provide?
So the services that Council on Aging of Buncombe County offer could really be summarized in several different categories. We offer health insurance services such as Medicare counseling through certified SHIP counselors, Affordable Care Act navigation, in addition to a benefits enrollment center that helps people connect with cost savings programs, determining eligibility, as well as assistance with applications and ensuring appropriate follow-up. With those health insurance services, we also offer wraparound care in our resource coordination team. Through internal and external referrals, we ensure that our clients are receiving services and support that meet their needs. That could include anything from caregiver support to elder justice navigation, as well as important access to products such as incontinence supplies and nutrition. We offer homebound food delivery, and with our resource coordination team, we are also committed every day to ensuring options counseling, information, and assistance to help people navigate the system. So in addition to those resource coordination teams and health insurance services, one of our largest and fastest growing programs is in senior nutrition. So we operate 4 different dining sites in Buncombe County, ensuring people receive the nutrition and wellness services that they've come to count on. So aside from the main programs, Council on Aging is also known for volunteer transportation service called Call a Ride, as well as minor home repair. So just to give you a glimpse into the everyday, the average client is about 72 years old who's on a fixed income and might come to Council on Aging for assistance with a grab bar, but through our home visit and through our client assessment, we might recognize that that individual also has other needs. So through applications assistance and care management, we might help that person save hundreds of dollars every month so that they can lead a better life in general.
Very good.
How about the Council on Aging in Henderson County, Keith?
Well, there are some similarities and some differences. Our mission is providing and coordinating services that engage, connect, and support adults in our community as we age. And there's a couple of words in there that we very carefully chose to talk about who we are. The first is providing and coordinating services. So there are some things that we do, we deliver those services directly. But like you, we have the resource coordination function that helps to connect the dots for people. So if people don't know where to go, we can understand what their situation is and help to point them to services that are available within the community, whatever they are, whether they're our services or somebody else's. The second piece that's really important in that is that word community. Because we are a community of people that we serve, but also that serve. We're very heavily dependent on a volunteer base that helps to support what we do and the people that we serve. We partner with other organizations in the county to get things done. And so that sense of community from our staff to our volunteers to the clients we serve and the general public is really important for us. And the last word that I like to kind of focus on in our mission is the word we. As we age, because we're all going through this process and we're at various stages in that spectrum, and the actual number of your age doesn't necessarily determine where you are on that spectrum. And so we know that different people are going through different challenges, and in fact younger people can be dealing with challenges with aging for an aging parent or an aging grandparent, and trying to figure out, how do I navigate this system? So we want to be there for anybody in that spectrum. So some of the services that we provide, we do have a heavy nutrition component to what we do as well. And so we're the sole provider for Meals on Wheels in Henderson County. That obviously means delivering a nutritious meal to a homebound older adult that has difficulty preparing meals on their own. As mentioned, that's a very heavily volunteer-driven activity, so we're very dependent on that pool of resources to help us make that happen. We also have one congregate dining site, like you have your 4. We have the Lunch at the Sammy Williams Center, where people can get together and socialize in addition to having a nutritious meal. And we have a liquid nutrition component to our nutrition services as well, where we provide Ensure or Glucerna products for those who have difficulty getting proper nutrition from regular food. So that's kind of our nutrition suite. We have a suite of caregiver services that we can provide for people who are caring for a loved one and getting burned out and need some respite time, need to be able to get some time away for themselves. So that's a great program that we're able to help support those folks. We have we're kind of the lead agency for Henderson County for the Senior Companion Program. So we talk about socialization and isolation being such a challenge. We're able to help connect volunteers that want to reach out and spend time with their peers, older adults that want to help older adults. And so we can connect those folks and have those senior companions just providing friendship or assistance around the house, as well as transportation. We have a heat relief program in the summer where we provide fans for the community, thanks to a grant from Duke Energy. And then last, we have our community resource coordination function, as you do, to help connect the dots for people that just don't know where to go otherwise. So.
Wonderful.
So, so as we all know, COVID has had a huge impact on all the things that we do and life in general. How has it affected what you do?
That is one of the largest questions, Keith, isn't it? So, as Keith and I both mentioned, both councils on aging for Henderson County and of Buncombe County support caregivers and provide nutrition services and are always looking for ways to enhance programs, both through finding funding from donors and sponsors and looking at new grant opportunities and looking from the strategic lens about how we can continue to evolve and grow. COVID has not only enhanced that need to acquire additional funding to support the new needs of individuals who either have never accessed services and support before, or who may recognize now that due to financial burden or other major changes during this pandemic have enhanced needs to acquire more support. So we're really looking at issues with health insurance, enhanced caregiver burden, financial strains, and of course the impact of social isolation on this vulnerable population. But we're also seeing those who are traditionally more active and still age 60 and over, who are facing real issues with opportunities for civic engagement or opportunities for transportation, facing unemployment. Who are struggling to choose between food and rent and utility payments. And what we know about this group of individuals who've never accessed services and support before is sometimes there's a stigma with that. And sometimes there's also the burden of knowing where to go or who to turn to, and even just how to ask for help. So our team is committed to letting people know that we've not only remained open during this crisis, but we are growing and enhancing our programs to meet those needs. So during this crisis, those ongoing needs of the aging population have certainly become more prevalent, haven't they?
Yes.
But we are bracing ourselves ultimately for the ongoing strain that this pandemic has put on those age 60 and older and their families, those who are also in their 50s who are coming into that age group of which we traditionally serve. We're also looking to expand into some of the more rural counties where services and support may be lagging or otherwise lacking. So the Council on Aging of Buncombe County has picked up a contract in Madison County as well to serve some of those caregivers with additional respite options. But certainly we're seeing that hidden hunger and transportation needs and the impact of social isolation on overall health are some of the key areas that we're focusing on. So we have expanded our homebound food delivery program, which allows us to deliver more food more frequently to people who are either traditionally homebound or are social distancing to play it safe. We've also enhanced our senior dining program, and while we have closed our congregate sites, we're delivering meals and allowing for curbside pickup. With our caregiver respite program, we've worked really hard on emergency planning and preparedness for those who need the respite in the case that respite options are limited or they or their loved one themselves become sick. We have gone full force into new outreach models and really looking to fill the gaps and to reach more people than ever before, particularly those in the minority population and those who, again, as we've said, have never had to access services and support prior to COVID-19 or didn't realize that they might be eligible for that. I think one of the biggest myths that we've uncovered during this time is that our services are only for the low income. And while many of our programs do have income eligibility, there are also many programs that don't. So we really do serve people across the board so long as they meet some basic guidelines depending on what the program is. So what we've really seen is not only the ability to expand, but also this enhanced coordination with our partners, whether that be with Adult Day Health or the Area Agency on Aging and others that are very essential to the work that we do every day, like Manna Food Bank, for instance. Working with some of the local churches, engaging with the low-income housing apartment complexes. So right now we're in that mode of problem solving, and we're really looking at the challenges we knew existed before at this high level. So things are really coming to surface. So really we're looking to move things online. So for instance, our Medicare counseling has gone virtual. Our caregiver respite, while it does remain fully engaged in the program, we had paused our support group. So we're resuming that on a virtual platform as well. And that CAPES group meets monthly beginning in October on Zoom. So we've really had to repurpose some employees with new tasks for enhanced service models and push people outside of their comfort zones a little bit, but all in the shared goal to continue to meet the needs of our aging population and to provide the support that's needed, especially when it's needed the most. How about Council on Aging in Henderson County?
Yeah, you've said so many wonderful things there, Heather, about the challenges that have presented themselves in this environment. For us, in the Meals on Wheels program being kind of the flagship of what we do and such a big part of it, that was the biggest challenge for us to adapt and adjust with COVID. We were accustomed to delivering a daily hot meal that's already prepared, ready to go to all of our clients through that network of volunteers that we mentioned. We had to, kind of change direction at the end of March, and since that time we've been delivering a weekly package of 5 frozen meals to those clients, knowing that that's not the best model because they're not getting that daily contact, that daily socialization, that daily safety check that they've got in the old times. But we are able to get the nutrition out to them. And the silver lining to that has been, as you mentioned, the ability to expand. We've been able to grow that program and add 5 new routes, bringing our capacity up another 50 to 60 people that we can serve during this time. So that's been a real blessing to be able to reach more people with the needed nutrition. And as you said, you see more and more of that need starting to kind of surface in the community now. I think initially it was a little bit more under wraps, less visible. Some of the other services and programs that were available and funding that was available has started to diminish or disappear. We're starting to see that need significantly more now. So it's been great to be able to expand and meet those needs. Our congregate dining site, like you, has provided sort of a curbside pickup kind of thing. And one of the things that we've added to that is where we had that opportunity for socialization and different activities. The socialization has to keep the distance, but we're doing some entertainment in the parking lot, some exercise classes in the chairs in the parking lot when the weather permits. So it's been still an opportunity for those folks to come to the center, be able to pick up some meals, but also to do some of the things that they're accustomed to doing, even though it's outdoors. So we'll have to see how that changes as the weather turns for the worse, but we're excited that we've been able to keep some of that going in the parking lot. Our senior companion program obviously has been, the people going into the homes hasn't been happening, so they've been maintaining phone contact, but haven't been able to have that personal face-to-face visit. So we look forward to the day that will change and they can get back in and meeting personally with those folks. And then, caregiver services, as you said, the challenges with, people being able to go into the homes. But we saw an initial drop in that in March, April timeframe as nobody wanted anyone coming into their homes. Now, as those caregivers are pent up with their loved one even more, we're seeing that demand just start to skyrocket, and they want the people to come in so they can get that break and get that relief. So that is beginning to really rise again, and it's good that we're able to help support that. The other thing I would mention is our challenge at the main office has been just the ability to have walk-in people. So our community resource function frequently would have people would just walk in off the street or set an appointment, come in and visit with the person face to face, and we haven't been able to do that during that time. But we're still handling all of that by the phone, so we're not discontinuing the service, just doing it virtually through the phone.
Do you feel like that was something you had to contend with as an organization early on, letting people know that we were still working, that we were still available, that although we were closed to the public, these programs were still running and services were being provided?
Yeah, absolutely. And I think, we saw, other than Meals on Wheels, we saw a dip in most of what happened in March and April as people kind of all shut themselves in. And as they realized this wasn't going to be a short-term thing, you started to see people reaching out for help. And so that just, again, kind of started skyrocketing later in May, June timeframe and since then. So, yeah. So, looking forward, what does the future look like for you?
So as part of that vision for the future with successful aging for all, it's truly taking a deeper dive into the needs that either have not yet been addressed with service gaps and different models in which could be enhanced through coordinated outreach, but really looking at enhancing that diversity and inclusion within our organization so that we can better serve all people within Buncombe County. A large part of what the Council on Aging of Buncombe County also would like to see going forward, say in the next 5 years that would roll into the next 10 years and beyond, is taking what we've learned and utilizing the resources that we've had allocated to us to help shape the lives of some of the counties surrounding Buncombe County that are still facing service gaps. So really taking best practices and using them as examples throughout our region. So we continue to coordinate with Land of Sky Regional Council as the AAA in our area and also other organizations. And I feel that we learn a lot from the Council on Aging in Henderson County, just as we do from aging service organizations in counties outside of Buncombe, and that we continue to have this conversation and widen our impact and to really begin to advocate for change. So while we might feel powerless in certain directions when it comes to policy, we're going to continue speaking up for the people that are aging in community and recognizing that these needs of individuals of all socioeconomic levels are important for us together as a community. So I'd love to hear more about how Council on Aging in Henderson County sees the vision.
Yeah, I think you hit the word you used earlier, the silver linings that we've seen with COVID. I think it's certainly opened our eyes to where some of the needs are in the community, and particularly for those folks who want to remain in their homes. I think we've seen there already it's a difficult decision for a family to decide whether you want to go into a facility, you want to go into some kind of a communal living kind of scenario. Now with COVID-19, fewer people want to go into that kind of scenario. So what is it that we need to do or could do to help people remain safely in their homes as they are looking at what does it take to stay there safely? And I think that's what I see as our future. We're already addressing the nutritional needs of a lot of people who are homebound. But through our community resource coordination function, we hear over and over again in-home services, transportation, home modifications and repairs, socialization, and so how can we address those kinds of needs? How can we either partner with others in the community or provide certain services ourselves, or, as you mentioned, advocate for those in the community? Maybe there's some issues that we can't solve alone, but we can be the voice for the people that we're serving. So that's what I see as the opportunity for us as we move forward, at least in the short term, to help to wrap around some services that help those folks that we're already serving, as well as to be able to reach an audience that we may not be currently serving. So.
Thank you.
Yeah, likewise. And I've enjoyed our partnership and our opportunity to learn from one another, and look forward to that continuing. And we certainly encourage all of you to keep the conversation going, to reach out to us at the contacts that will be on the screen here, and let us know what questions, concerns, or thoughts that you have on how we can continue to serve you. Thank you.
Special thanks to Blue Ridge Community College, our presenters and national conference partners who made the Aging in Place, It's in Your Future virtual fall and spring national conference series possible. Visit us at agingprojectsinc.org or contact us for further information. Our online resource is specially designed to help seniors, caregivers, providers, and community organizations find the resources to assist seniors to age in place. Please keep Aging Projects in your gift-giving plans. Your generous support of Aging Projects, a registered nonprofit, will contribute to our Aging in Place initiatives, including the Aging in Place, It's in Your Future virtual fall and spring national conference series.